What should a rhinoplasty consultation be like? I find that the consultation is one of the most essential parts to a successful rhinoplasty, so I take them very seriously. My rhinoplasty consultations are at least 30 minutes. It can't be fast. You have to sit down and you have to collaborate with the surgeon. You have to go back and forth so that the surgeon can understand what your aesthetics desires are and come to a final agreement on what our goals are aesthetically. If you're not doing that, then you're very likely getting a very generic nose that you're not really sure what it's going to look like. So during the consultation, I always sit down with my patients. I start off open-ended, asking them what are the things that they see about their nose? What are the things that they think they want changed? I then use that to represent that visually. We use computer morphing software because rather than just saying things and saying the nose rotated or refined, I mean, those are ranges. That can mean a whole lot of stuff, and that really doesn't always help the patient understand what that's going to look like on their face. So by using computer morphing images, I'm able to show them what I think they mean. And sometimes it's spot on, and we say, yes, is this what you mean? Great. During the process, I'm also able to make suggestions because I do have some experience in rhinoplasty and facial aesthetics, and I also know how things may turn out, what is functional, what fits, what doesn't. And so throughout the process, as they're telling me things, I'm morphing the images, but I'm also making these suggestions, and the patients may say yay or nay. They may like it, they may dislike it, but I'm also able to show them in certain areas, well, hey, this is the limit of what a realistic expectation may be. So with this collaborative process, we're coming to a final end result where we can say that, yes, it's realistic, it'll be functional, it'll harmonize with your facial aesthetics, and it will also jive with your aesthetic desires. That's really one of the main parts of the consultation. The rest of it is really for the patient to feel out the surgeon. Is the surgeon just giving you quick answers? Are they taking the time to explain what they're going to do or what their assessment is? Some surgeons are just very terse. Maybe they're good surgeons and maybe just don't want to take the time to explain. But I think it's very important that once we come to that final result, that I explain to them why I think their nose looks the way it does and what needs to be changed in what way. For example, if your tip is bulbous. Is it bulbous because your cartilage is too curved? Is it bulbous because the cartilage just has a orientation that goes up like this, creating no support here and too much fullness here? Or is it just simply too wide and we can just do a little what we call a cephalic trim? So there are many different areas of the nose like that, and I like to really go through it with patients and explain it to them. That's something I think every patient should look for in a consultation, is if they're not explaining it, you really question, what is happening, what is going to be done. Is this going to be just a quick generic kind of a, rhinoplasty where I'm going to get a generic result? The other part is where patients get to ask questions. You learn a lot about rhinoplasty on videos like this one, but you want to ask the surgeon themselves, what am I expecting during the surgery, after the surgery? So that consultation really helps you understand the process as a whole, from what your goal is. Do you understand what you're doing? Can you explain what your plan is for me? And then please explain to me what the recovery and intraoperative process is going to be, and what can I expect during the 1 to 2 years where my nose is refining and changing. So really that's what you should expect. I believe this is what you should expect from a good, thorough consultation. And a lot of this is because I see a lot of revision patients, and I always ask them, well, you're not happy with this or that. Did you discuss this? And very frequently it's, well, either we said it and they explained it, but I didn't really see that in morphed images, or it was kind of just covered very quickly. Now, this is not always the case, but this is one of the issues that I find that patients run into. So definitely look for someone that's going to give you their attention, because if they're going to give you their attention during the consultation and explain things, then they're more likely to give you their attention during the surgery and try to do the best job possible.